Tell me about sprained ankle.
Basically what happens with a sprained ankle, the most common is an inversion injury. So your foot actually rolls kind of up underneath your leg area. There's several different types of sprains. The one you talk about where you can kind of walk it off is usually a mild sprain. You get 3 main ligaments in that ankle. You stretch them, you don't tear any of the ligaments, so they just get a little stretch to them, and that's why they rehab so quickly. You can have a more moderate sprain where you actually get partial tearing, and then you can have a severe strain, the black and blue swollen, that takes a long time to heal, where you actually tear completely some of the ligaments.
Are these usually the tendons that are on the outside of the ankle?
Yes, everyone thinks about the outside of the ankle as being the most common, so it's around that smaller bone, that fibula that I was
And
addressing.
so you can get a partial tear or a complete tear?
Correct.
How do you know the difference? How does the person know?
Usually, the more severe sprains are the ones that you can't really walk on. They'll come hobbling in on crutches. Like you said before, they'll be very swollen, very black and blue. On physical exam, we can tell if you can get the patient to relax long enough to test them that they'll have some increased motion through that ankle.
So you can tell that by examination. If you can get somebody to loosen up and relax a little bit, you can say, uh-oh, without an x-ray.
Yes.
When you see somebody that's had a partial tear or a full tear, what's the treatment?
Basically, you want to get the swelling down as quickly as possible and get them back on their feet. A very severe sprain, a lot of people now will actually cast them for about a week or 2 just to let everything kind of calm down. The quicker you can get the swelling out, the faster you can rehab them. Once you kind of get them comfortable enough to weight bear, then we start working with the physical therapist, working on getting their motion, their strength back, getting their flexibility back.
If you've got a complete tear, do you have to go and sew it back up? Do you have to operate on those ankles?
Most of the time, no. If you have just a single sprain, single issue, usually those ligaments will heal on their own. It's just a matter of making sure that you rehab it appropriately. The people that have long-term problems are usually those that either don't get into any rehab or don't do the rehab they're supposed to, so they don't ever regain that motion and strength.
Do you think putting a cast on the ankle, if it's a severe sprain, is a good thing to do to let the foot sort of heal? Does it ever get too stiff in a cast?
Usually not. That's why we use the cast for just a week or 2. Usually I'll cast them for a week and bring them back. Some people will actually use a boot walker instead so they can get to it and ice it a little bit better. There was actually a recent article in the sports medicine literature a couple years ago that actually supported the idea of casting for a week or 2 to really help with the swelling.
Let me get back to some basics. Early sprain, do you want to put ice on it or do you want to put heat on it? What do you want to do to get better quicker?
We usually talk about the RICE method, the rest, the ice, compression, and elevation.
So that's RICE, RICE.
Correct. Easy to remember and easy to do.